Good morning, good afternoon, good evening everyone. I'm Parisa Khani, student of Ayurveda in India. Today we are going to have a lecture in subject of Rajaswala Charya, means menstruation diet. This lecture will help by Dr. Hetal H. She is Associate Professor of National Institute of Ayurveda, NIA Jaipur in Prastuti Tantra and Stri Roga Department. She has practiced for 26 years in women disease, infertility and menstruation disorders. She also has taught for 20 years to Ayurvedic students in NIA. This lecture will be bilingual, means at first Dr. Hetal will help lecture in English for 15 minutes and after her I will explain the summary of lecture in Farsi for 5 minutes. سلام و خوش آمد عرض میکنم خدمت تمامی پارسی زبانان عزیز که از سراسر دنیا با ما همراه هستید. من پریسا خانی، دانشجوی آیورودا از هندوستان هستم. امروز با یک ارائه در خدمتتون خواهیم بود با موضوع راجاسوالا چاریا به معنی تغذیه آیورودایی دوره قاعدگی بانوان. این ارائه توسط خانم دکتر هتال برگزار خواهد شد. ایشون دانشیار دانشگاه NIA جیپور در دپارتمان زنان و زایمان هستند. ایشون سابقه 26 سال درمان آیورودایی بیماری‌های زنان، ناباروری و مشکلات قاعدگی رو دارند. همچنین ایشون 20 سال سابقه تدریس در دانشگاه NIA جیپور به دانشجویان آیورودایی در دپارتمان زنان و زایمان رو دارند. این ارائه به صورت 2 زبانه خواهد بود. در ابتدا خانم دکتر به مدت 15 دقیقه به زبان انگلیسی ارائه رو انجام خواهند داد و پس از اون بنده به مدت 5 دقیقه به صورت خلاصه به زبان فارسی خدمت شما عزیزان ترجمه خواهم کرد. نماسکار مa'am. We are waiting for you. Please ma'am.
Namaskar to all. Today I am presenting my topic Rajaswala Charya, Ayurvedic lifestyle of menstruating woman. What is Ayurveda? First we know small brief introduction of Ayurveda. Perhaps many of you know Ayurveda is the oldest science and medicine system in the world. Ayurveda has given 50% emphasis to prevent the health of the healthy person and 50% aim is if someone is diseased then make that person disease free. Artasya roganut swasthasya swasthya rakshanam. This is the main aim of Ayurveda. So out of them I am representing first aim Rajaswala Charya. In Ayurveda there is a presentation description of the so many points: Ritu Charya, Din Charya, Garbhini Paricharya. All the topics deal with the preventive aspect of the life. When there is a season change, Ayurveda says us regarding the some change in the food, some change in the lifestyle, and there is a change in the mental activity also. At this time, we are take care of the girl and women. Whenever in little age, in the younger age, after the age of 12, one girl or women, one girl is menstruating, yani menstruation starts. At that time, she is defined as Rajaswala. Rajaswala means a girl who has menses occurred. At that time, there is a very good food regime, some lifestyle and some mental activity described by Ayurveda Maharshis, and it is very good, useful to make a Dhatu Samya. What is Dhatu Samya? Dhatu Samya is a homeostasis. Then, when our Vata, Pitta and Kapha, you know, perhaps you know, Vata, Pitta, Kapha, 3 points. Under these 3 points, Ayurveda science is described. So at that time, if we have equilibrium, good equilibrium of the Vata, Pitta and Kapha, then healthy person remains healthy. So at that time, during Rajaswala period, if we follow the advice of the ancient acharyas, which type of the food should be taken by a person, by a girl or woman, so it will make her healthy, very good happiness, and there is a prevention of the so many disease. It is a very good part of the Ayurveda. Swasthasya urjaskaram. And if healthy people is taking this type of the food, then there is a very little chance and perhaps no chance of the any disease. So I am telling you first important point regarding the Rajaswala Charya. Why Rajaswala Charya is so much important? Because nowadays in world and with some peer-reviewed articles also, and WHO, World Health Organization, is also worried about the incidence of the gynecological disorder during the girl yani adolescent period, during the reproductive period. Reproductive period denotes 12 to 50 years of the woman, because after 47, perhaps 48, either 50 age, one woman in menopause will occur menopause at the age of around the 50. So after 50, there is a some different type of the paricharya, different type of the lifestyle advised by the acharyas. But we now denote with the Rajaswala. So because WHO and all other health system is also worried about there is a very big incidence of the dysmenorrhea and hypomenorrhea and menorrhagia, PCOD. So all these occurrence of the gynecological disorder increase day by day. And I have present some peer reviewed articles reference in front of you. Something in Iran also primary dysmenorrhea incidence is 73%, and PCOD is reported also, polycystic ovarian syndrome, PCOS also reported 7.1 to 14%. Yani different incidence and percentage occurred in the all over the world also. So if we stop this occurrence, yeah, if we minimize this occurrence, so we can follow the Rajaswala Charya. As I told you previously, Rajaswala means menstruating girl or woman, and Charya means to eat, to consume, to be engaged in, to be busy with all 3 days of the menstruating flow. So special food is described by Acharya Charak and Acharya Shushrut, Acharya Vagbhat, Bhav Prakash. All Acharya has advised almost same food during this period. What food should be taken? Shali rice, barley, milk and ghee is advised to take during the flow days. It means we have not to take some spicy food, some pungent food, some other taste of the food is not advised during the flow days of the 3 to 5 days, and we can take sweet fruits during this period. Out of that 4 food, sali rice, barley, milk and ghee, we can prepare anything. Suppose sali rice with ghee, sagrita salyodanadi, acharya dalhan has advised. Kshiram sanskritam yavannam iti eke, it is also advised by Acharya Dalhan in the Niban Sangra. That means barley cooked in milk means payasam, yani sali rice with ghee, sali rice with milk, barley with milk and ghee. You can prepare anything and you can take morning, evening and dinner with this food. And this food is very much useful in the to prevent the disease, to make a homeostasis, to make a life happier, healthier and enthusiastic. I have seen in my clinical life since last 26 years, I have suggested this food to my so many patients and so many my students also, because last 20 years I am teacher also. So I have suggested without any medicine to my so many students also, and it is so much effective. We can consume this diet during the flow days, and we can benefited ourselves. uh, Sour taste fruits we can't take, है ना, just sweet fruits, banana, pomegranate, apple, pear, all the fruits we can, but sour in taste we can't take. It is not advised by the acharyas. Effect of this Rajaswala Charya, I have observed in my life, and I have also done my PhD in same subjects in the Rajaswala Charya on the different patterns of the menstrual cycle, and we have got excellent result in dysmenorrhea. There is a very good pain relief without any medicines. Whenever we are giving medicine along with, so we can't give all the credit to Rajaswala Charya. But I have seen without any medicine, if we are taking and giving this Rajaswala Charya food, means barley, rice, ghee and dugh. And all four food item is very good effective in pain relief, and there is no need of any painkiller analgesics during the flow days. Second point, there is a very good bleeding amount minimized. If there is a heavy bleeding, if there is a appropriate bleeding occurred previously, then it is not minimized by Rajaswala Charya. But if there is a heavy bleeding due to some problem, yani some disease, some uterus fibroid and something else, in spite of that, there is a minimize in the bleeding amount. There is a very good hormonal balance. Some of my patient has informed me after taking Rajaswala Charya food, there is a very good light feeling from inside, and there is a very glow on the skin. You can read also one article, dermatological health and effect of Rajaswala Charya in peer-reviewed article. So it is also, you can got on the internet. So there is a very good hormonal balance and inner light feeling and healthy feeling all over the 27 days of the month. It is a very good feeling. Some of my obese volunteer or patient has achieved a very good weight loss with only help of Rajaswala Charya. So it is also very good. Sometimes due to heavy weight, yani obesity, there is a occurrence of the so many disease in the body. So, or everyone want to live a healthy and happy and long life. So weight loss and appropriate weight is maintained by the Rajaswala Charya I have observed in my clinical life. Just I have informed you that there is a very good dermatological health, so there is no pimples, and there is a regularity of the menstrual cycle. There is a one question from so many lectures I have previously delivered. Okay, if I have no problem in the menstrual cycle, then it is necessary to follow the Rajaswala Charya. Yes, because Rajaswala Charya is a healthy person diet. But we have observed if there is a little one difficulty and diseased condition, not so severe condition, then Rajaswala Charya is also effective in previous condition also. है ना? So in healthy condition is also advised, and if there is an initiation of the some disturbance, so it will regularized by the Rajaswala Charya. It is also decrease the risk of the diabetes. So there is a very good effect, because I have given one reference also from Bhav Prakash and Gaidas and the Dalhan also. Raja Prasekat Nari Masi Masi Vishuddhati Sarvasari Dosanscha Na Pramehatiyantas Kriya. So there is a very good reference, and via this reference we have observed clinically that there is a very good effect on to decrease the risk of diabetes, and ratio of the menstrual irregularities is rising in the gynecological practice, which is the precursor of the infertility also. जैसे suppose के PCOD is a precursor of infertility, means whenever there is a infertility, we have seen clinically there may be more chance of the polycystic ovarian syndrome and other problem also. So we can minimize this, and there is a very good reference by Acharya Bhel. There is a sattvic progeny and healthy progeny via Rajaswala Charya. So you perhaps know sattvic, rajasic, tamasic, all three guna, manasik guna, yani mental guna, and via this there is a very good description with food also. If we are taking sattvic food, so we will prevent ourselves from so many diseases. So it is a very good for the healthy person and diseased person also. So via this sattvic food Rajaswala Charya, we can give a baby and new offspring in this world with very good quality, very good sattvic gun. It will create very good heaven in this world, and so many happy, healthy or humanity work in the world. So it is a very effective Rajaswala Charya, so we should follow. I have given one poster also in English and in Persian language also, so you can send to your relatives, and in brief, during the flow days of the Rajaswala, we can use this barley, rice, ghee and doodh with sweet fruits. Don't take sweet fruits and milk all together. There should be some separation, because it is a viruddhahar as per the reference of Ayurveda. And thank you so much to Nava International to give me chance to present my topic of the Rajaswala Charya in front of so many big personalities and so many people. And I am also want to thank my student Dr. Avinish, Dr. Fatima, Dr. Parisa and Dr. Salisu from the Nigeria. Thank you very much. Without the help of your active support, it's not possible to deliver this lecture in a very good manner. And I wish you all please follow Rajaswala Charya. After following Rajaswala Charya, we can make all the women very healthy, happy, and for the preparation of the Shresi Praja, mani healthy progeny. Namaskar to all.
On behalf of Nava International, I would also like to thank Dr. Hetal for her time. We understand that she has very busy schedule, and also thanks for sharing her attention, wisdom and knowledge. Also, I would like to share with you that there is a brochure that we'll post together with this post on Instagram and all social media that is both in English and Farsi. Please feel free to share it with your friends, colleagues and family. Feel free to share this knowledge from India. Also, as Dr. Hetal said, she encourages you to practice this diet for 3 months, and after 3 months, please come back to this post and share your personal experience as comment below. Now I would like to translate it in Farsi. راجاسوالا چاریا، تغذیه آیورودایی دوران قاعدگی بانوان. دانش کهن آیورودا 2 هدف اصلی رو دنبال میکنه. اول حفظ سلامتی در انسانهای سالم و دوم درمان بیماری در بیماریها. راجاسوالا چاریا در راستای هدف اول آیورودا یعنی حفظ سلامتی در انسانهای سالم هستش. راجاسوالا به معنی خانم یا دختری هستش که سیکل قاعدگی یا پریود رو تجربه میکنه و چاریا به معنی خوردن، مصرف کردن یا رژیم غذایی هستش. توصیه میشه راجاسوالا چاریا در سنین باروری مورد استفاده قرار بگیره که سن باروری 12 تا 50 سالگی هستش. از دیدگاه آیورودا ما 3 دوشای جسمی داریم، واتا، پیتا و کافا، که وقتی که این دوشاها با هم در تعادل قرار میگیرن بدن سلامتی رو تجربه میکنه. با رعایت راجاسوالا چاریا دوشاهای یک خانم در دوران پریود یا دوران قاعدگی در تعادل قرار میگیرن و این هستش که باعث حفظ سلامتی در خانم ها میشه. طبق آمار WHO سازمان بهداشت جهانی بیماری های شایع بین بانوان بسیار زیاد هستش و باعث نگرانی در تصمیم گیری های WHO شده. طبق آمار مجله سلامت ایرانیان بیماری هایی مثل دیسمنوریا، هایپرمنوریا، هایپومنوریا، PCOD، PCOS و انواع سرطان ها مثل سرطان تخمدان، سرطان سینه، سرطان دهان رحم جزو بیماری‌های شایع در بین بانوان ایرانی هستش. این آمارها که خانم دکتر اعلام کردن خدمتتون به صورت مفصل نشان دهنده این هستش که ما نیاز داریم به اعمال روش یا روش‌های جهت پیشگیری از این بیماری‌ها. توصیه آیورودا راجاسوالا چاریا هستش. خب الان میخوام توضیح بدیم راجاسوالا چاریا چی هستش. باید راجاسوالا چاریا در روزهای خاصی مورد استفاده قرار بگیره که از روز اول خونریزی تا روز سوم هستش. اگر خانم هایی هستن که بیشتر از 3 روز دوران خونریزیشون طول میکشه، بهتره در تمام طول دوره خونریزیشون این رژیم غذایی رو رعایت بکنن، یعنی بین مثلا روز اول تا روز سوم یا روز پنجم. حالا این مواد غذایی چی هستش؟ این مواد غذایی شامل برنج قرمز، شیر، گی و جو هستش که اینا رو میتونیم به صورت تنها یا به صورت ترکیبی مورد استفاده قرار بدیم. مثلا میتونیم برنج قرمز رو با کردگی به صورت کته درست کنیم، مورد استفاده قرار بدیم. برنج قرمز رو همراه با شیر حالت شیر برنج درست کنیم یا جو رو همراه با کردگی بپزیم و مورد استفاده قرار بدیم. همچنین توصیه میشه به استفاده از میوه‌های شیرین مثل موز، سیب، انگور، انار شیرین، هندوانه و هر نوع میوه شیرینی که در دسترس هستش در کشورهای مختلف میتونه مورد استفاده قرار بگیره. مرکبات در این گروه قرار نمیگیرن و مورد استفاده قرار نمیگیرن. ترکیب فقط یه نکته در این زمینه هستش که ترکیب شیر همراه با میوه های شیرین از دیدگاه آیورودا ویرود آهارا حساب میشه، به این معنی که این ترکیب در بدن تولید آما میکنه و تجمع آما باعث بروز بیماری میشه. پس لطفا این ترکیب رو استفاده نکنید در این روزهای قاعدگی. در مورد فواید راجاسوالا چاریا که چه فوایدی داره، اولیش این هستش که باعث کاهش دردهای قاعدگی و به طور کلی باعث حذف دردهای قاعدگی بدون استفاده هر نوع مسکنی میشه. فایده دیگهش باعث تنظیم خونریزی میشه. اگه خونریزی ها کم هستش باعث میشه که به حالت نرمال برگرده و اگر بیشتر از حالت عادی هم هستش مجدد کمک میکنه که این به حالت عادی برگرده. در مورد عزیزانی که مشکل فیبروم دارن و خونریزی های شدید دارن در دوران قاعدگیشون، پیروی از راجاسوالا چاریا باعث کاهش چشمگیر مقدار خونریزیشون خواهد شد. باعث بهبود جوش ها و باعث شادابی پوست خواهد شد، باعث افزایش شادی، باعث احساس سبکی میشه راجاسوالا چاریا و موجب کم کردن ناباروری در خانم ها میشه، باعث رسیدن به وزن مناسب میشه در عزیزانی که مشکل چاقی دارن، سبب تعادل هورمون ها میشه، سبب تنظیم سیکل قاعدگی میشه و کاهش ریسک دیابت در خانم ها میشه استفاده از این رژیم غذایی. و در خانم هایی که این رژیم رو رعایت میکنن و باردار میشن، نطفه‌ای که تشکیل میشه در بدنشون صرف نظر از اینکه پدر چه رژیم غذایی رو مصرف میکنه نطفه ساتویک خواهد بود، به این معنی که جنین دارای سلامت ذهنی خواهد بود. و به غیر از اینکه استفاده از راجاسوالا چاریا باعث میشه ما خودمون به سلامت برسیم، باعث میشه که نسل بعدی سالمی رو هم به جامعهمون تحویل بدیم. خانم دکتر زحمت کشیدن، خلاصه این مطالب رو به صورت بروشور در اختیار ما قرار دادن و دوستان زحمت کشیدن، از زبان هندی به زبان انگلیسی و فارسی ترجمه کردن. ما اونو در اختیار شما قرار میدیم و ازتون خواهش میکنیم که با دوستان، همکاران، فامیل این رو به اشتراک بذارین و دستی باشید در نشر این آگاهی. خانم دکتر پیشنهاد کردن که 3 ماه این رژیم غذایی رو مصرف کنید تا بتونید اثراتش رو ببینید و ما هم ازتون خواهش میکنیم که بعد از انجام این کار لطف کنید برگردید به این پست و تجربه شخصی خودتون رو در مورد استفاده از این رژیم غذایی در زیر این پست به صورت کامنت برای ما بنویسید و ما خوشحال میشیم که بخونیم نظرات شما و بقیه دوستانم قطعا خواهند خوند و استفاده خواهند کرد. خانم دکتر تشکر کردم بابت فضایی که به ایشون داده شد و ما هم تشکر کردیم از ایشون و به خاطر اینکه ایشون اومدن و این دانششون رو در خدمت جامعه پارسی زبان قرار دادن. ممنون که تا این لحظه همراه ما بودید، ما رو همراهی کردین. شاد و سلامت باشین. نماسکار.